How can I interpret STI test results after exposure? Getting tested for sexually transmitted infections after potential exposure can feel overwhelming, but understanding what your results mean is key to taking the right next steps. When you receive your test results, they generally fall into 3 categories: positive, negative, or inconclusive. Each one tells a different story about your health and what actions you should consider. A positive result indicates that the laboratory has detected evidence of an infection. This evidence could be antibodies, antigens, or the pathogen itself, depending on the test used. A positive test means you have an active infection or, in some cases, a past infection that might still be detectable. If your result is positive, it's important to see a healthcare provider promptly. They can confirm the diagnosis with additional testing if needed, discuss treatment options, and help you notify any sexual partners to prevent further spread. Many infections like Chlamydia and Gonorrhea are treatable with antibiotics, while others like herpes or HIV requiring ongoing management but can be effectively controlled with medication. A negative result means no evidence of the tested STI was found at the time of testing. However, it doesn't always guarantee you are free of infection. This is especially true if testing was done too soon after exposure, during what's called the window period. The window period is the time between exposure and when the infection can be reliably detected by tests. For some STIs like herpes or HIV, this can take several weeks. Because of this, retesting after the window period is often recommended to confirm negative results and ensure accuracy. Sometimes, test results can be inconclusive or unclear. This can happen if testing occurs during the early stages of infection, when the body has not yet produced enough antibodies or antigens to be detected. If this happens, your healthcare provider might suggest retesting after some time or using different testing methods to clarify your status. It's always best to follow their advice to get an accurate picture of your health. Timing plays a crucial role in test accuracy. For example, testing within 2 to 7 days after exposure might not give reliable results for many STIs. More accurate detection for infections like Chlamydia, Gonorrhea, and HIV PCR tests is usually possible at around 7 to 10 days. By 14 to 21 days, most tests reach their highest accuracy, often around 95%. Waiting until this period ensures the most reliable results. False positives can happen, especially if testing is done too early or if there are technical issues. A false positive means the test indicates an infection when there isn't one. That's why confirmatory testing is essential after a positive result. For example, HIV screening tests are typically followed by more specific tests like Western blot or viral load measurements to confirm the diagnosis. Once you have your results, your next steps depend on what they show. If positive, see your healthcare provider for treatment and counseling, and inform your partners so they can get tested too. If negative but you tested soon after exposure, retesting after the recommended window period is wise. If your results are inconclusive, avoid sexual activity until you have clear results from retesting. Always discuss your results with a healthcare professional who can give personalized advice based on your situation. In summary, interpreting STI test results involves understanding that timing affects accuracy, positive results requiring confirmation and treatment, negative results might need retesting, and inconclusive results need follow-up testing. Remember, every person's situation is different, so consulting a healthcare provider is the best way to ensure you get the right care and peace of mind.